This topic is called Mixing Up the Medicine, the Art and Science of Ketamine Assisted Therapy and Getting the Most from the Process. And I stole the title from a Bob Dylan song. Those of you who know me know that I'm a big thief of Bob Dylan, and I'm going to read it to you. It goes, Johnny's in the basement, mixing up the medicine. I'm on the pavement, thinking about the government, the man in the trench coat, badge out, laid off, says he's got a bad cough, wants to get paid off. So these are tough times, and I really wanted to just bring our consciousness to that. I'm hearing it from so many of my clients, and it's just in the environment, and that's why a place like this is so important. And I wanted to start off thanking you, Jacob, for bringing this place together. You are a master convener. And the community needs places like this. So appreciate you. Appreciate all of you for coming here tonight. We're in competition with the film festival, which, you know, we can compete with Hollywood anytime. And the rain. So double thanks for being here tonight. It's a good time for reflection also, and self-examination, and getting our priorities right. And to me, the medicine is the best guide for bringing us there. And I've been in practice for many decades, and Samantha, you've been around, and I have not seen any kind of results the way I have seen doing the medicine work. And I can say that wholeheartedly from the bottom of my heart, in the depth of my experience. The kinds of changes that I see through the power of the medicine is monumental. It's important for us to pay attention to all that, but also it's not the medicine itself. It's all the variables involved. It's doing it right. It's doing it with the right people. It's doing it with full awareness and intention of why you're doing it, what you're there for, and who you're with as you're doing it. So these are the things that we're here to talk with you about. And in acknowledgement that so many of us are doing these medicines, seems to be, statistics vary, but it seems like 25% of the population has already done psychedelics. The numbers are growing monumentally, and it's just increasing day by day. So we want to have it open and accessible to all, but we want it to be safe. We want it to be helpful. We want it to serve the purpose that you're there to do it for. And that's kind of what we're here to talk about. Ketamine is primarily what I do and also what you do as a professional. So we're not going to talk about all the medicines. I want to say that I fully support the use of those in a responsible, risk-averse way with the right people in the right setting. But we're going to talk to you about kind of how we proceed in helping people who are seeking healing, who are seeking self-awareness and evolution and even transpersonal experiences through the medicine in the hands of a professional. So we tonight are going to focus on our collaborative model and what we see as best practices, and what it really means for you if you're a seeker to relinquish yourself to the medicine and to the experience, and to know that you can do that because you're in a safe space with a knowledgeable, experienced person there at your side. There are many ways that you can access ketamine. It's really accessible now, more than it ever has been. And that's great, and it's also a little scary because you can go into any clinic and say, I want a shot of ketamine right now, and you probably could get it if you have your credit card. And that doesn't mean you're going to get the experience that you're looking for, and it doesn't mean that you won't be harmed as a result. So part of this is just to increase awareness of if you're going to put this in your body and open up yourself in the most vulnerable and trusting experience, that you're doing it in a way that really makes sense. So before we get into the content of what this means, mixing up the medicines, the point was it's a collaborative model. And it's really a mix of the art of psychotherapy when you're doing it in a psychotherapeutic context and the science of the medicine behind it that you're putting in your body. And for this reason, this is really the only work I do in collaboration, full collaboration with an expert, and that's my medical practitioner partner, Samantha Lau, because my expertise is psychotherapy and people and working as a guide in this healing process. But when it comes to questions about medical issues, combining ketamine with other medicines, other ailments and illnesses, even chronic pain, that's not my area. And so I love that I get to collaborate with you. So I'm just going to turn it over to you to introduce yourself and say a little bit about who you are.
Right. Thank you so much. I have to say that I've been such I feel very honored to be able to work with you and the work that we've done. Like it blows my mind. Thank you for coming, and thank you, Jacob, for inviting me to this space. It's such a beautiful community here too. My story, I've been very curious about healing since I was very young. As a child, I was taken to work with my grandfather, who was a veterinarian, and just kind of observing how he helped the animals heal, doing procedures, and help them recover. That sense of compassion and the sense of connection really stuck with me. That led me to healthcare. And yeah, later on, got into becoming a psychiatric nurse practitioner. So doing the traditional psychiatry work, and now exploring, new and more transformative treatment, such as ketamine assisted psychotherapy. I have been a psych NP for about 16 years, and I've also has never seen anything like ketamine and also psychedelics, how it transformed, the whole person. And it really gives you a window to look at, what it means to heal. It's the body, the mind, and the spirit. And I also got trained in MDMA and psilocybin assisted psychotherapy. I hope that it will get approved soon because, I really believe in those two medicines as well. Beyond all the science, what really drives me as a clinician is understanding human behavior, how we heal, how we connect, and how we find a way back to ourselves after trauma. I unfortunately have firsthand experience with PTSD. I had a break-in many years ago, and that really changed my life and how I practice as a clinician. And yeah, I understand how it can deeply shape the nervous system. I'm not the same person again. Uh, some in some really good ways, and sometimes I'm very acute to my environment. But that brings me to talk about my passion to help women heal from trauma, and to help them reclaim their sense of self, the sense of safety. And my practice name is Elevate Her, so very feminine. But I do have like 40% of my patients are male. Um, but yeah, and ketamine is such a tool to you know bring that healing to another level.
I realized I didn't introduce myself, but I've talked before here, so maybe you all remember. And I won't give you my whole resume because as you get older, it gets longer. And we would be here a long time. But essentially, I've been a therapist my whole life, even in my childhood. And also a leader of programs, and especially for marginalized populations. And then I went into full-time academia, and I ran a psychology program. And that experience in the political world of academia was so trying that I got directed to a psychedelic assisted guide to help me figure out how to navigate that world. And I had my first psychedelic assisted experience with MDMA. And my entire life changed in that 7 hours. And I have been a practicing therapist for almost 30 years at that point. And I was like, wow, there's no going back. There is no going back, because I knew I needed to deliver that to my clients as well. I had really done like 7 years of work in 7 hours. And so if anyone thinks, and by the way, I get these calls all the time, wow, you're so expensive. If you think it's expensive, try going to therapy for 7 years versus 7 hours, okay? Now, I'm not asserting that you will be cured in 7 hours, but it is a consolidated experience. So it's actually cost effective. So I'll just say that as a sidebar. So after that, good evening. Someone with us?
The AI, yeah.
Oh, hi.
Sorry.
Hello, AI.
Thought I was having a transpersonal moment.
From the other dimension.
So then I got trained. I went to the CPTR program, and I got trained as a psychedelic assisted therapist, and then got MDMA training with MAPS, and then did ketamine training with the Ketamine Training Center, and got all this training and certificate. I'm also a somatic therapist, so the combination of psychedelics and body are really big for me. And then I had no idea what I was going to do with all that, and fell into this job as a VP of a ketamine assisted therapy company that was developing clinics across 3 countries. And I was overseeing all of that and literally building the plane while we flew, because most of us don't know what we're doing, actually. I'll just say that, because there's so much to learn. There is so many growth areas in this field that even the experts will say, we don't really know. We don't really know. We're finding out. We're learning. We're developing. So I will just say that. And after that company folded because they grew too fast, too big, which many startups do, I found myself back where I began, like T.S. Eliot says, in my practice. And I am never been happier. Never been happier. Because to me, the most relaxing thing in the world is actually to sit with my clients in their journey. It is such a wonderful space to be fully present with someone that way, in their evolution, in their touching the places that are hard to touch, in that heart opening that really never happens anywhere else. So that's kind of how I landed here right now. And I'm grateful every minute. So that's, I think, us. And so maybe I'll just start out with what happens when someone comes to me and I think, oh, I got to get Samantha involved. Mm-hmm. So sometimes I'll just get a call out of the blue. Oh, I heard you do psychedelics. Can I come see you? And then I clarify, I do ketamine assisted therapy. And I'll just say one more thing. Ketamine is great because it's available. It's a very inexpensive medicine. It's legal. But really why I love it is a different reason. And it's personal to me. Everybody has their medicine that they prefer, perhaps. It really lets the body alone. To me, the body is, it's a dissociative medicine, as it's called. But what happens much of the time is your body's not bothering you, and you're not focused on it, so that you can really do an inner journey. You can really pay attention to the things that you're there for, the self-exploration, the hard things you sometimes avoid, the opening of your heart to other experience, sights, sounds, images, music, because your body's not getting in the way. And that's really the thing I love best about ketamine. So I'll just say that. Some people ask me, can I come do psychedelics? I say I can do ketamine assisted therapy with you. And then I explain what that's all about. And what it's all about is I need to get to know you. And so it's not just you're going to come in and we're going to do the medicine and that's the end of it. So I will have them come in. I get a sense of them. It may take 1 session. It may take 20. But until I know who they are and what they're there for and what their background is, what their vulnerabilities might be, how we work together, have a sense that they feel safe with me and I have a deep enough sense of them, we're not going to the next step of recommending the ketamine.
That's so important. It's crucial. It's so important because you're so vulnerable, when you're under the influence of ketamine and you're dissociating, you're altered. And also, if you don't feel safe with the person who's next to you, how are you going to let go? Right? Yeah.
So if we go through all that, and I send them a lot of material, I send a lot of information about what to expect and what it looks like and what the medicine's about and what I'll be doing and what my setting is like and what that day of will be like. And then if it's a green light, if I think, yeah, this person is really a good candidate and I'm happy to be part of that, then I say, well, you got to see Samantha Lau. They're like, oh, I have to see somebody else. And I'm like, she's great. So that's when I will contact you or have them contact you. I have them sign a consent so Samantha and I can talk openly and take.
Yeah, right. So usually I would, hear about the case with the consent of the person, and I'll, dig deep with their psychiatric history. I'll do a really comprehensive evaluation on their medical history as well, making sure that they don't have any contraindication. Ketamine, it's great. It can, you can be on other antidepressants and be doing the work with the medicine. But there's some medications that you should avoid, and maybe you need to hold it for a day or two. And, for example, what are some criteria or exclusion if you just had a heart surgery, like that you're not a candidate? I've had someone contacting me, was 2 weeks ago, and maybe you can't do this medicine just yet. Any recent traumatic brain injury, if you have hyperpressure or any cardiac condition that's not treated, hyperthyroidism also, it's a contraindication. The medicine can increase the heart rate and it can bump up your blood pressure. And if if you have any history of psychosis in the past, like how was it presented? Like, do you have any history of schizophrenia in the family? Or maybe that's emerging in your own human experience too. So that's a contraindication to do CAP work. And any bladder infection.
Yeah, and sometimes someone will say to me, well, I'm taking Buspar and, some other, and then I just contact you.
Yeah. And that's okay. Like Buspar, it's very comfortable. That's because ketamine is very different than SSRI or any antidepressant out there. It focuses on a receptor called NMDA receptors, and it triggers the release of glutamate, and also it encourages the BDNF, brain-derived neurotropic factor, that people often refer as brain fertilizer. It helps you to encourage the regrowth of any available dendritic like connection and association, and it can take you to a very spiritual place as well.
Yeah. The other thing that I actually really like about ketamine is it's short. And so you're not in for like a whole day necessarily, because the other medicines could be 6, 7, 8 hours. And that's great too. But sometimes, you can get a lot done. And I leave 3 hours for a ketamine session, depending on the dose. It might take the whole 3 hours, sometimes an hour and a half or 2, depending how the person metabolizes it. But I want plenty of space so that if it's a green light and Samantha says, yeah, this person is a candidate, and then you write the prescription, you want to talk about that?
We work with rapid dissolving tablets, so it's a sublingual formulation. Sometimes I would prescribe intranasal formulation as well if they can't tolerate a sublingual. And in my office, I do both, and sometimes a mix of sublingual and then an intramuscular injection. But Mainly when I work with Elizabeth, like in her office, she does the sublingual tablets. Yep.
So once the prescription is in hand, usually it goes to the pharmacy, or sometimes it could be mailed to the person's house. They bring it in. And before that, there's a whole preparation, though, which I'm sure you're all familiar with. Because, set and setting is everything, and set is about mindset. And you want to talk about that in advance. It's not just walk into a clinic, take the drugs, and you're in. It's, think about what you want for your journey. Clear the space at a time. Take even a few days, if you can, before to reflect, to journal, to write, to dance, to sing, whatever kind of moves your spirit and opens your heart. And even prepare the space at home for when you get home. Stay off of social media. Don't watch horror movies. I mean, these are all things. I know it seems silly to have to say it, but people just do these naturally. And then, if you're going to watch some scary movie the night before your journey, it is very likely to enter into your journey. And you don't want that. Okay, so clear space before, clear space after. And then we have a lot of conversation about what to expect when you come in. So the preparation, it's all important, preparation, the medicine, and the integration with the three components.
Anything you want to say, maybe? I guess during the evaluation, I do sometimes encounter people who are binge drinking and they want to stop drinking. And I will work with those people to maybe put them on their naltrexone or send it back to you, work on reducing the alcohol consumption first. And then start the cap work.
Yeah.
Yeah.
That's an important conversation too, because you're going to get really sick if you've got alcohol in your system and you're doing ketamine. And then, there's not eating several hours before. All of those things are really clearly laid out. And the point of sharing this with all of you is for your information. There is a structure to this to keep you safe. And you want to know that the person that you're working with is paying attention. Okay? Because you don't want to pay attention to that. That's not what you're paying attention to. What I want when you come to me is to pay attention to your inner connection, to getting to know yourself, to being willing and open to looking at things that you kind of tiptoe around, the things that are scary, maybe, or the things that are joyous even. I had an experience recently with a client. I mean, she came to work on, really tough family stuff, and she was having the greatest ketamine experience, laughing and smiling and playing. And I was like, I had never seen this side of you. And she said, yeah, I love it. I can do that. I just can hardly ever do it. And the work was really about tapping into those experiences for her. So it's not all about, oh, this is going to be a hard journey, scary stuff. It's also very playful and fun and creative. And so we're working on all these elements. What I don't want you to work on when you're coming in is being worried about, is everything taken care of? Am I going to get sick? What if I throw up? That's fine, because I'm in charge of that. So really important. Yeah. Okay.
Yeah, you talk about vomiting.
Yeah.
So it can be very nauseating with the sublingual formulation. Usually people get nauseated when they land and when they come back to their body. So to mitigate that, they will ask the client to maybe stop eating 4 hours before and then stop drinking any fluid 2 hours before. And I'll prep them with Zofran, some anti-nausea medication ahead of time, and that can really help.
Yeah, and there is something to the idea that vomiting is purging. And sometimes people feel really great afterwards. So it's not that you want to be afraid of it or discourage it. It can happen, and it's just fine. And it actually rarely happens, in truth.
But when it happens, it's awful. It's really awful. It's not like ayahuasca kind of purging. Use the jive healing.
Yeah.
No.
So the medicine experience is a very sacred thing to me. And my office looks very different on that day. There's all kinds of elements, incense, music, and plants and things to really note that this is a very different set-aside experience. This is not, just another appointment in your day. And to me, that's very important, to separate it out from everything else you do. This is not your usual experience. You're going to lie down. You can choose. I encourage people to use an eye mask just so you go internal, because that's what most people are here for in the therapy space. There's music that's, I think, very soothing, and chimes. And
Sometimes dramatic music is better, to really invoke that emotion. Yeah. And then you get to work with the materials that you normally don't have access to.
Yeah.
Yeah.
And again, there's not a formula, because I've gotten to know you. And some people really respond, say, to a poem or meditation. So I might open with that. And some people are like, oh, no, I hate meditating. I don't want to do. So I don't do that. I had a client who, she saw my ceremonial stuff and she said, can we just skip that? It's like, okay, you know what? Let's just, breathe together for a minute, because you just want to be grounded and present. That's really the point of it. And if some kind of ceremony you're doing is putting someone off, that's not helpful, even if you love it. So to me, it's really every person has a unique response and sensory awareness, and you want to be responsive to that.
Sometimes they bring their own rituals, right? That's always welcoming.
Yeah.
Elizabeth, how do you determine dosing, working with a client?
Well, usually I talk to you about recommended dose. Usually I start first time lower.
Yeah.
Because
What do you see?
especially if it's a person's first ketamine experience, because they don't know how, none of us know how it's going to affect a singular individual, right? So start low-ish. And then the recommendation is usually 6 sessions for a kind of cohesive, coherent, and really deep ketamine experience. I'm not rigid about that. It's simply what the clinical trials have come out with. I might recommend it because I see it as kind of a retreat experience. You are now dedicating yourself to yourself for a series of deep and deepening and deeper experiences. So it seems to work pretty well to do it once a week. There's always medicine and then an integration session. I'll talk about the integration. We'll talk about that in a little bit. And if you do that over a period of 6 weeks, you're really kind of in a retreat space with the client. And I find it very effective. But there are some people who want to do 1 or 2, and I'm open to that. So there's not a formula for that. There's not a formula for how to open it or for the music necessarily. There are ketamine playlists. There are psychedelic playlists. I'm sure you're all familiar with those. I don't do a whole lot of changing up of the music during the medicine experience, because I want people to stay focused on what they're there for, which is being curious about what the journey is, not what's the next playlist, or I don't really like that song, could we find a different song? Then they're getting into technicalities. And so some people disagree with that, but that's just how I work. My goal is to just support the letting go. My message to people is, set your intentions and hold them loosely, and just be curious about what the medicine will show you, because we just never know.
Yeah, I guess I will add more on the series of 6. There's some magic to it. I observe people, doing just one session, and they can go really deep and they earn a lot of insights. But when you do repeat the journey, you get to feel this new level of wellness. And usually after 3 sessions, people start to kind of feel different. And then the 4th session, people would say, things that used to trigger me, it doesn't trigger me anymore, or it's less intense. And the 5th and the 6th one, it's really there to make that treatment last.
I agree with that. Yeah. which is why I really do recommend doing a deep continuation of experiences. Yeah. And just one other thing during the medicine, I encourage people, if you want to speak, speak. If you want to sing, sing. Do whatever you want. My job is going to be to keep you safe and to note whatever's happening. You don't have to remember it because I'm going to write it down and we'll be talking about it later. You don't have to understand it because we'll talk about that later too. You just be in it and trust that I'm in it with you, and I really am. Sometimes it looks like you're doing nothing, but I'm just so present with whatever's going on for the person. I really feel it in the depths of my...
Yeah, it's actually really hard to sit in and really do it really well, because you have to be fully present to the person, and also knowing what not to say, and when to say things, because you can't interfere with their own inner intelligence, right? Own inner healing intelligence.
Yeah, I'm really
Intuition.
aligned with you on that.
Yeah.
Less is more. I really tend to say very little during the medicine session because the idea is for the client, for the person to just be moving through the doors of perception really on their own. And if I get in the way, then I'm blocking them. And then they're somewhere else. Suddenly they're alert to me and talking to me or pleasing me even. And we don't want that. So I'll just say, if you want to really remember something, you just say the word out loud. It doesn't have to make sense. I'll write it down. Because people are very worried they won't remember what happens. So there's that.
Yeah, I take notes, and you do too. Yeah, it's really helpful, for them to review their notes and see, oh, I said this, and that was a great insight. So on dosing, you said, they usually start with maybe one tablet, which is 100 milligrams, and then you can always take more, of course. And the fully psychedelic dose, usually 300 to 400 milligrams. And I know some practice would, prescribe like 500, 600. But I don't do, I stop at 400 usually. I think beyond that, it's just over-prescribing, and you should really consider intramuscular experience, yeah.
I think you said earlier that it was sublingual.
Sublingual, yeah. It's actually the more difficult, the most difficult part of the journey can be the time that you're holding the tablets. It's very bitter. They said that it's flavored with like mango, but tastes nothing like mango. I've tried that before. You have to hold the tablets underneath your tongue for 15 minutes. So all your saliva and the medicine for 15 minutes, because that's inside of your mouth. It's the best site of absorption. Yeah. Mm-hmm.
Yeah, the other thing I wanted to mention, because sometimes, someone will need to use the restroom during the journey. Sometimes they get up. I always have a conversation with them in the preparation before the medicine day about consensual touch. And this is really important. If any of you have ever been with a guy or a clinic, you really have to have that conversation because you may need assistance moving. And so I will never touch a client without talking about it ahead of time. So if you need to use the restroom, is it okay if I hold your arm? Because you may need help. So yeah, that's okay. What if you want me to hold your hand? How will I know that? So we create a signal. Okay. What if you want me to hold your feet? No, I don't want that. Or, whatever it is. If the blanket falls off you, can I put it back on? I have a weighted blanket, so it's kind of like goes to the floor sometimes. So it may seem silly, but it's about the person feeling safe. Like, I'm not going to do anything unless you and I have really talked about it when you're not in the medicine experience. Because once you're in it, anything goes. But not on my end, because my job is to protect the space that we structured. So, and, plenty of times people do need assistance getting to the bathroom or something. I've had people who do want to stand up in the middle of the session, even though they're in the dissociative state, and that's okay. You don't want to constrain anyone. I'm just hovering and making sure that everybody's safe and if I think maybe you shouldn't be on your feet, I'll say, maybe you should be on your feet. Do you want to try to lie down again? The other thing I just want to say about the medicine journey, there's, as a therapist, you kind of watch out for people being afraid to talk about things or resisting things. We use that word. Sometimes the resistance in medicine looks a little different, where the person will, in the middle of the music and the eye shades, they'll take off the eye shades and go, nothing's happening. I don't feel anything. And, this isn't working. And, it could be true. And it probably feels true. And a lot of the time it's because people are scared. Think about it. You're just like going into this whole other space. I imagine many of you have had psychedelic journeys, and it can be a little scary going into this, the K-hole or this, I don't know where I'm going experience. And the way out is to pull yourself out of the experience. And so people will do that. And I don't fight with people about that because, we only do what we're really ready to do, but I will encourage people, maybe you want to just try with the eye shades. Why don't you just lie there with the eye shades and listen to the music and just see what happens? And if nothing happens, nothing happens, but maybe something will happen. I've had people go back into a very deep experience after that. So there are some interventions during the medicine journey that are really important. And I'm saying this to you from the position of a practitioner, but also maybe some of you are practitioners, some of you are maybe clients, and you want to know that you have permission to do these things in a session. You have permission to say, I don't really feel it, or I, want to stand up, or can you help me get to the bathroom, whatever it is you need. You want to know that you feel safe and that you can ask for it, which is part of why I'm saying all of this.
Yeah. I do intramuscular session in my office, and I can get really precise with that. Like, it's not better than sublingual formulation. Sometimes sublingual formulations are more beautiful because the absorption, the psychokinetic, curve is different than the spike that injection can get you to. Like, you just take off in 3 minutes and boom, you're coming back. But with sublingual can be really,
it's more gentle.
Gentle, and just, it gives the ego some time to, like, I guess, negotiation, like make it feel safe. Oh, what am I doing? Oh, this is like, I'm feeling this and I'm feeling deeper and I'm safe. I've seen a lot of remission with sublingual sessions with therapist presence.
Yeah. So into the third hour of the medicine session, we're sitting, there's music. It's so really relaxing and wonderful. I will check in. What?
Sometimes not.
Sometimes not. Well, even I've had very intense sessions that are still wonderful. Where someone could be expressing a lot of anger or screaming and crying, and even that is wonderful because there's something really important happening. So yeah, good point. It's all beautiful is really what I want to say, because so much is going on, so much is shifting. And if the person seems kind of still and it's getting into the third hour, I want to start to move into a shift, because what I never want someone to do is leave my office when they're not ready. And I won't. I won't let them go if they think they're ready and I don't think they're ready. So that's something we agree upon ahead of time, that no matter what, I have to agree that you're ready. That's what I'm the boss of, because I keep you safe. And what I say is, you want to come out of the journey earlier and talk to me, you can do that anytime. But if it's moving towards the end and they're still in it, I might just touch them on the shoulder, say, do you think you might want to come out and talk to me? And I've had people say no, because they're really having an experience. Or people say, yeah, sure. And so, they might just lie there. They might then sit up. And at some point I might just say, do you want to say anything about where you've been? Just open-ended. And maybe they'll be like, no, I'm not ready to talk. Or, yeah, wow, I just went to, my childhood home. Or, boy, I was in this tunnel and there were all these witches. And, so you get, it's a lot like dream tending. You just want to get the download of, what did you dream? What was your medicine experience? And I take really copious notes then. And I stay away from interpretation, because they're still in their journey. They're just on the edge. They're coming out. They're coming out. They're coming out. But it's not the time for analyzing or interpreting or going into the head, because we're still in the heart space. And we're still in that creative play space of, let's talk about what you just saw and but, you know, where did you go next? And you really just want to hear what happened. And anything you want to say about that?
No. Okay. Yeah. Sometimes I do take help people to recall their experience, not going into interpretation, but just, hey, you know, let me help you recall. If you want me to do that, I'll just go over my notes, like what I wrote down, what I write down, and you know what they said earlier, like with the first injection, or you know, early on, and they start to, oh yeah, I remember this, and then I asked them for a little bit more information. Do you want to expand more? What did you really see? What did you experience?
Yeah, they may have just said a word like orange tree.
Yeah.
Like, do you remember you said orange tree? Oh yeah, there was an orange tree and I was climbing it. You know, so it's very helpful, even if they just say a word and we wrote it down. So there's questions going on. Do you want us to wait and do a Q&A later, Jacob? I mean, what's the structure of your... I'm happy to take some questions. And I just want to say...
Judith has a mic.
Okay, we didn't get to the integration part yet. So if you have questions about that, hold off. But sure.
So just curious, a low dose, 100 milligram sublingual, 3-hour session?
No, usually we do 100 and then ask if they want a booster. But some people have done 100, and I say to them, I'm setting aside 3 hours. You can stay the whole time or not. You can use the time or not. But I'll tell you if I think you're ready to leave. And I actually watch them get up and walk and see how they're doing.
You are for days?
Yeah. Oh, when would I do that?
I think in 15 minutes after just later for a little bit, and you would, like, the person would know, like, I feel like I can go deeper, and they feel safe to do so, and they can hold another tablet. But dosing, it's an art too. Like I have seen people with 400 milligrams like all at once and feel very mild experienced. And some people at 100 milligrams had a complete ego dissolution. I have experienced that with a client. And so you can always take more, but
more is not necessarily more.
I think
It's really not.
Yeah. When the person is not ready for that kind of experience, it can traumatize them.
And this is where our collaboration, I think, is really helpful, because we discuss dose quite a bit.
Right. And after they finish their own first experience, I would do a medical follow-up with them and just making sure how they recover, if they have a headache, or was it, were they able to drop into that transpersonal space? Like, are they ready for a bigger dose? And it's all kind of talked about during that follow-up. Yeah. Thank you.
Yes. I had a question. I get a lot of imagery when I do it, and I tend to talk a lot just because, I get a lot of stuff. So where you talked about, you're asking the person what they remember. There's so many things that go on in these sessions I've done that I can't even remember everything. And I was just wondering, I actually turn a little recorder and then verbalize it, but I don't know how much of that is actually taken away from the experience of verbalizing it, or
Are you doing it with a therapist or a guide?
no, just on my own.
On your own.
I do through an app.
Why do you think it's taking away from the experience?
I don't know. I was just wondering what your opinion. I've never talked to anybody about my experience other than through the Mind Bloom. Mind Bloom is the group. So it's just really, it's...
I guess, any external relationship is something that will be in your awareness. So if it's being recorded, there's the danger that you might be performing for the recording. I don't know. That's all I can see. I think it's probably valuable if you're alone.
Yeah, I'm glad you held your own session.
It's a lot of babbling though, but I was just wondering if, because I'm just wondering if talking about it, I like to talk when I'm going through it. So I don't know how much that takes away from Or now is okay. Okay.
No. Some people say nothing the whole time. Some people say a few words. Some people talk the whole time. So
Sometimes it can be a really good session to do therapy.
except that I'm not doing any analytic anything. I'm not interpreting for them. Yeah.
Yeah. Psychedelic dose.
Hi, my name is Brett. I have 2 questions for you. First, the Bob Dylan song, was that, I was trying to remember the words of that. Is that Hurricane?
No, it's Tombstone Blues.
Got it. All right. It was similar to Hurricane. Number 2, when is your next
That's
available?
the most important question of the evening by her.
The next one is, when is your next available appointment?
Maybe I should share that. Okay, thank you. I appreciate that. So then the person has ended their journey. I'm giving you the kind of trajectory in a linear fashion. It's not very linear because there's so many dimensions happening for the person, for me, for what's happening in the room. There's like a third between me and the other person. There's this third experience of our shared experience. So there really is, I mean, I could talk about this all night, so I'm just going to leave that for the moment. Person looks like they're ready to leave. I see them standing on their feet. They have a ride, which has been arranged ahead of time. Nobody's ever going to drive away from this experience on my watch. And we prepare all that ahead of time. And if I know they're going to be home alone that night, I will tell them, I'm just going to check on you. I'm just going to text you, see how you're doing. If they have a partner, I won't do that because I don't want them looking at their phones. If they feel that they can stay away from their phone, great. Because that is, your kind of evening to download, to just reflect on what happened, to journal, to draw, to dance, to sing, to play, to take a walk, to connect with nature, to do things that you find healing. And I forgot to mention that I always have a sketch pad and markers in the room too, because some people really do like to draw rather than speak. So there's all the creative elements are encouraged. And then you'll do the kind of check-in with them also. The next day is usually the integration, the day after, usually within 48 hours. And that's really a session to talk about what happened. The first thing I usually ask is, how'd it go when you left my office? Because the journey continues. And the medicine is still in you for quite a while, though not in the same activating way. So I'm always very curious about how the rest of the time went. And that's part of the conversation. And then we talk about the journey and what their impressions are, why they think this is what came to them in the medicine experience. We get a little more into interpreting, why did you see that orange tree or the tunnel? Why do you think? And, it is a lot like dream tending and dream analysis in that way. It really is amazing what people will come up with. But beyond the sort of interpretation, there's a lot of just kind of sensory opening that people have. It's like, boy, I feel lighter than I've ever felt in my life. Or, I was smiling the whole night. That's the kind of stuff I hear. And then as it goes on for weeks, I just feel better than I've ever felt. I don't know what it is. I've been laughing so much. I'm dancing again. Stuff that just bubbles up from the body. That isn't thought about. It's not preconceived. It's not being performed or presented. It's really just happening as a result of the medicine experience. So for me, what I want to do is help elicit people sharing that, people, finding that in themselves to share with me so we can note it, so we can observe it, so we can do more of what feels good and really kind of elevate the beauty that's come from the medicine experience. So the integration is also very complicated in that way because so much can come from that as well. And, I think that's really it. What I want to say about the 3 parts of how I work, except that some people continue in a therapy with me beyond the ketamine because there's so much of life, to build on that. And, I'm still working with people in therapy who have done, a whole 6 session of ketamine treatment. And, just yesterday, this woman says to me, I'm just so grateful for the work we did because it just prepared me for everything that followed and that feeling of being safe with you. And, it's just so gratifying. And, therapists, it feels really good to hear that, but I don't take credit for it, really. I know I'm part of it, but it's the medicine, it's the setting, it's the music, it's the collaborative work that we do.
Well, it's also your presence.
It's the totality. It's the presence. Yeah. So, obviously, I'm a big proponent. Obviously, you are your people here at the District216 Psychedelic Fantastic Club. So I want to just open it up. Anything you want to add? Or
No, I think it was good. Any questions?
So you're saying that you do the ketamine experience and then you have another therapy session the next day?
Mm-hmm.
Okay.
And if possible, some people's schedules don't allow it. 2 days, 48 hours is kind of the window where people seem to be still in this open space where they, first of all, you want to be able to really remember what happened, but also open to talking about it. And ketamine really is heart opening. And, so people seem to go places that they've never been able to go, even in the days that follow. And that opening is the healing, really, in the presence of someone they trust. Yeah. And why it's important to do it so soon, because life takes over. If you wait a few weeks, something happened and, your kid is having a problem in school and all of a sudden you're dealing with that, or you're buying a new car, whatever it is, your life is taking over and the ketamine experience takes a back burner. So you don't want to lose that. And that's, part of the talk here. Talk is about optimizing the experience. That's really part of it. It's like, get it while it's fresh, because a lot of juice is in that experience and you want to really, really mine it.
I just had a client who did an IM session just yesterday, and he said, well, I don't want to integrate. I was like, what? And I sent him the note that I took. And he said, oh my God, I just had a good cry reading the notes. And he was able to really recall the experience and something that was really making sense to him the next day. And now he said he wants that appointment back to integrate.
Why didn't he want to integrate, did he say?
I think he felt like he could, make meaning of it on his own, which sometimes that's the case. But for that particular case, he had a really deep journey. A lot of different memories came up, and it's always good to, talk to a therapist and help you connect the dots.
Yeah, I'll just say that, I've had so many talks with people where they're like, I do mushrooms on my own, I do ketamine on my own, what do I need a therapist? You don't need a therapist. You really don't need a therapist. You can benefit from sitting with someone who knows what they're doing and who's going to keep you safe, because then you can really submit to the medicine. And, I've myself, full disclosure, I've done it both ways, on my own, with a friend, with a partner, and with a therapist. And to me, that experience of having someone who's not connected to me, who's totally there for me, and who is trained professionally to do this work, that's when I can really let go. So, you can do it all kinds of ways, but they're different. They're not the same. Mark?
Hi there. I'm a ketamine assisted psychotherapist and hypnotherapist, and may I just explain why it's so important afterwards, according to brainwaves? Your dominant brainwaves when you're on ketamine are in theta, like a deep meditating monk, or like when you're born to when you're 7, 8 years old, you're in your imagination in theta brainwaves. So you're open to suggestion, your core values you put in. After you do the ketamine for 12 to 72 hours, you're still in theta. So it's really important what you put into your mind and what the work you do to help people look at programs differently. And one of my other favorite things about ketamine is it just changes your perspective on life. I just went through a separation, and the first time I got my first divorce, it took me 4 years of depression to get over. I did ketamine 3 days afterwards and had some therapy with it. And it was a couple months ago, and I'm in really good shape. So ketamine's just wondrous. So please give it a chance. And these beautiful. Thank you guys for doing the work you do.
Thank you. I'm so grateful to hear this kind of experience because it's true. It's not, again, it's not a miracle. Maybe it is a miracle, but it's not a quick fix bullet. You have to put your heart and soul into being open. That's all you have to do. Be curious and open. And the way to do that is to trust that someone else is watching all the other stuff. So thank you for sharing that.
And thank you for doing this work.
You know, with psilocybin and maybe with MDMA, there's a lot of discussion about neuroplasticity and having your brain learn some new patterns, and actually makes it, whatever you're working at, it makes it more enduring, I suppose. And that's the implication anyway. My question is whether with ketamine, they always talk about dissociation. Is that related to, or is that really a different thing than the neuroplasticity and reconnecting of neurons and so on?
Dissociation in the ketamine experience is, I can tell you that it's different than like just zoning out. I don't know if I'm answering the question right, but just want to put it out there that the dissociation that you have with ketamine, it dissociates you from your day-to-day identity. Like, so that's how you can really get a new perspective, is to not be yourself. Give your brain a rest, and you can, oh my God, like look at this past history from a different angle. It does help with neuroplasticity, and so does therapy on its own, and SSRIs.
Oh, absolutely. The neuroplasticity is more open than ever, which is why you want to have the therapeutic intervention on the heels of the medicine experience to keep the pathway open and form a new pattern if you can and want to.
I don't know if you hear that a lot. I sometimes, like, my patients would say, I've never thought this would be possible, you know, this new level of wellness. And, you know, that could be an amazing thing. It is an amazing world.
Other questions?
Could you talk about the impact of if you're taking antidepressants or other dry medications and how that you approach using ketamine or any other psychedelics?
Yeah, so with ketamine, you can work with any SSRIs. That's very safe because ketamine works on a different receptors. Medication like lamotrigine, that's gonna, you know, interfere with ketamine, so it will reduce the glutamate release. So usually we'll ask people to either hold it the day before or cut it in half if they can't tolerate not taking the medication. Also, it depends on the dose that they're taking at the time. Any like gabapentin, like I ask people to hold the night before. Alcohol can also take away the antidepressant effect of ketamine. So, you know, during your CAP work, like just avoid alcohol. But with most, even like lithium, you can work with ketamine. With psilocybin, if you're on lithium, like you can't. It's going to induce a seizure. Like it puts you at risk for seizure. You don't want to mix anything with LSD, I don't think. Although I have heard, you know, underground practitioners, they use, you know, give you some MDMA at first and then have you take some mushroom, like your second course. And then at the very end, give you a tiny bit of ketamine to kick you further into your space. So usually it's a lower dose because all these medication combined, they take you to a next level. So it's a long trip. It's a long trip. It can feel extremely deep. Yeah.
What about ADHD medication?
ADHD medications, I would usually ask people to hold it on the day before. I have had people, taking their stimulant in the morning and coming to the office in the afternoon. It really depends on your health and your blood pressure, because ketamine can bump up your heart rate during the session. You don't want to, go too high and be, in trouble.
A lot of people approach me questioning what happened with Matthew Perry and was it really the effects of ketamine? And I'm sure the audience would probably like to know a little bit about that and your thoughts on that.
I'll just say a quick thing. Don't take ketamine and go into a hot tub. When
you're going to have a K-hole. Hello.
That's all it is.
Yeah, he did. I agree.
Ketamine is a very safe medicine, but don't go in a hot tub.
Yeah, I would say the same thing. It's just very unfortunate, like the way he used it. I think he got injected with like a really, really high dose.
Which is maybe why he went in the hot tub.
Yeah. So don't do that.
But no, I'm glad you brought that up because it suddenly made people feel unsafe.
Yeah, exactly.
Because there was so much distortion about why he died.
And for your question, when you go into a K-hole, your dominant brainwaves are in gamma, so you're really not in your body anymore. And if you look in the EEG, every single neuron is connecting, new neural connections that haven't been going off, firing off in years. And if you... A lot of it, yeah. Like Joe Dispenza's work, where he gets you into that quantum field of possibilities, that's getting you in gamma, and ketamine does that as well.
Yeah, sometimes it can feel like a deep meditation session, with even like 100 milligrams sublingually.
And to me, again, that's the beauty of ketamine, because some of the other medicines will heighten your body awareness, and that get in the way, especially if you're body conscious or have body aches and pains, which a lot of people do, and it can interfere, where ketamine, you're all here, you're firing away, body gone.
Yeah. Elizabeth, you mentioned going into alpha, and he just spoke about gamma. So can you clarify that for me?
I think you should clarify it. Good question.
Gamma, you have to go down into theta before you can go into gamma, so you have to be really relaxed. And then you can, there's actually a hypnotic trance you can do to get people into gamma. That's when you're at your most creative. That's when, like, some of these athletes actually are, like Barry Sanders, when he played football as a running back, he would see other people in slow motion. You're in the zone. Gamma's heightened learning. You can connect with fifth dimension where your prayers are answered, different things like that, like in Joe Dispenza's work, or how people have these miraculous healings because they meditate into this quantum field of possibilities as if their cancer's gone. So, and have you heard of anyone actually doing any verbiage when people are doing a session and they're in a K-hole? Like everyone says, like, don't put any words to the music, but I don't know if you guys have experimenting with anything.
I know some practitioners, they do some sessions like that, with low dose, like 200 milligrams sublingual, or intramuscularly, like maybe, 40 milligrams, or, the dose that put them in a trance state. And you will start listening to recording of, or if you're with a hypnotherapist. I have actually tried hypnotize somebody, and it went into a very deep place that it was scary for the person. So after that, I stopped. I'm not like the best hypnotherapist out there.
I'll teach you.
Thank you. Yeah. I'll get your phone number. But I have heard practitioners doing this kind of work, or if you're, on your own doing this kind of work, you can consider experimenting.
Yeah, good. Thank you.
Mm-hmm.
Can you catch on the alpha side?
You're talking about gamma?
Well, alpha is just a relaxed state, and then theta is your next state where your brain waves are actually slower. So alpha starts coming into your brain waves, when you're 8 or 9 years old, and then you start getting into beta after that, where it's active thinking, and then you got stressful there. So you go from, when you wake up in the morning, you go from delta sleep waves to theta to alpha, and then most likely beta. So gamma is unusual to be able to get into, and the ketamine can get into it, a lot of the other psychedelics as well. And meditation to get into it.
Thank you. Do you want to talk about our retreat work?
Sure, yeah.
So, Samantha and I recently co-facilitated a retreat for first responders, and I'm going to do another one in a few weeks, and hopefully we'll collaborate again on another one. Why I mention it is because it's also important to speak to what happens in a group process energetically. And I'm sure some of you have been to some psychedelic retreat. How many of you have had that experience, or a group psychedelic experience? So a few of you. And so I just want to note that that's a very, very powerful experience, as well as the one-on-one with a therapist, because the group energy just feeds off of each other in a very powerful and potent and supportive, held way that people really feel loved and contained. And so I don't know how much detail to go into, but I mean, essentially what we did in this model is daily ketamine integration, ketamine break, ketamine integration. So a week of that. So it's pretty intense. It's at an off-site space, beautiful, aesthetics, connection to the environment and the beauty of the world. And we have plenty of that in California. So you have the aesthetic and you have the facilitators. There were 5 facilitators and 7 participants, 4 facilitators. Well, one was kind of an assistant, but plenty of help. And so everyone, feels really held. And I'll just say about this particular group, it was firefighters and EMTs and people who really see the hardest things that humans can possibly experience. And we're probably going to present about this at the MAPS conference, perhaps. But what was, to me, most striking about it, because I had expected they would talk about those unbelievable traumatic experiences, which they did on their own. But what ended up happening is they were really managing their childhood traumas in the ketamine sessions. And to me, it was very powerful to see that, because what I come away with is that the ketamine allows us to go in a safe, held space, and particularly with a group of like-minded people, to a place that they had never been. They had never talked about these experiences with anyone. They told us that. And so, these are the guys, they're tougher than anyone in this room, unless you're an EMT or firefighter, or tougher than me for sure. But they were children in that room, infants, dealing with their infant hurts. Anything you want to say, man? You were amazing.
I mean, it was beautiful. We did it with intramuscular injection, and there was. Well, I do want to highlight something, and because I was surprised to hear, like the organizer was like, "Oh, wow, you talked to them about dosing." Yeah, of course I do talk to them about dosing. Like, so I do spend some time sitting down with them, like, how do you feel about this dose? And they have to be comfortable with that. But I know some clinics don't really talk to you about dosing. Like, you don't even know how much you get. So if you do, such a session, like, ask and be informed, and you have to be comfortable with that dose. But that group work, like, you can just see those participants progress from day to day, and they start to really watch some at the very end.
There were different people by the end of that week. And by the way, these are people, they're very familiar with ketamine, because as EMTs, you'd use it all the time medically, but none of them have ever done psychedelics. None of them would ever have gone near psychedelics. They didn't tell their bosses where they were going, a lot of them, because that's not the popular, it's not a District216 group. But yet, exactly. By the end of it, they were like, "Oh, I'm going to tell everyone about this. This is amazing." So it's just another, really big piece of evidence about the power of this work. And I just, the group work in particular, because we were all very hands-on in the room. You know, everybody's doing the medicine in the room at the same time. And we were all very sitting by their side and holding them and very attentive. But they were really getting a lot from each other because of the openness. And they had never met before. Did I say that? They had never met until the day they walked into the retreat.
Was it 3 days on to 1 day off, 3 days on?
Exactly. Yeah. We did a prep on Zoom. That was the meeting. That's all. So, and the medicine evaluation I thought was terrific. I sat in on them just to be present. And the conversation with Samantha and the participant was just so meaningful in terms of, you know, because they have med speak. They know how to speak medicine and medication. But they were really open to your suggestions.
Because at different dose, it can be a completely different experience. You know, if they're ready to go deeper, like we can maybe, you know, I can suggest this range. And if they're not ready that day, you know, everybody feels different on a different day and they might pull back. So that's the conversation that I have with them.
Yeah.
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 What was the aftercare protocol of that group?
Such a great question. We had a couple of Zoom integration meetings in the weeks that followed. I might have done it differently. I wasn't in charge of the organizing. You know, like I say, I recommend the integration should be within a few days. It was like a week.
Yeah, I feel like your version of what
Ideally,
yeah.
We leave the retreat, you know, everybody's walking on their feet, everybody's in good shape, and I know it, and they're leaving, and we have the integration within 2 days. Yeah, and it can be Zoom, that's fine. And everybody has agreed to participate before they even signed up, so that everybody shows up. Yeah, because the cohesiveness of the group is part of the healing. And you want to maintain that through the integration. So you're asking such good questions. Thank you. All again. Any other questions?
Logistically, so I understand, Julie, in a typical scenario or session, so you're obviously primarily doing the integration work, Elizabeth, and then you're doing the dosing, Samantha. Are you in the same room?
So
or how does that?
we do the collaborative model, yes.
That's your normal model, though.
No, we're not in the same room.
Not in the same room. I do the medical evaluation and the psychiatric evaluation. And then I, you know, write them a prescription if they're a candidate for it. You know, prep them if they have blood pressure issue, like give them some blood pressure medication, treat that first. Treat the nausea also, prep them. And then I will send it.
That you had them back to.
Yeah, and I'll talk to her about, you know, this is the range that I think this person should start with, like, or this person has a lot of psychedelic experience, like they can go really deep right away. So we talk about dosing, and then if someone has sleep apnea, which we have actually encountered someone in the retreat, young, and you would never think that she has sleep apnea.
She didn't know it.
She probably has central sleep apnea. Yeah, she didn't know it, and you can desaturate your oxygen level can go down during the session. So that's something that I also screen out. Like if you know that you have sleep apnea, I usually recommend the person to sit upright to do the work. Like you can still do the work, and some people might need to wear the CPAP, which can be disruptive, but we don't want that person to, you know, go.
An eye mask that would stay on here.
Yeah. And just, you know, to clarify, I'm very clear that I'm not a medical person. I know what I am, and that's a therapist. And so I leave the medical attention to Samantha. I don't even touch the medicine. So I have a client bring it, the client open it, the client dose themselves. Yeah, I'm not a doctor. I'm not that kind of doctor. I have them put on their own CPAP and blood pressure cuff if they need it. So all of that, you know, I'm very clear about staying within my scope of practice, in my lane. And also I know what my lane is. I'm, you know, fine with that too. So yeah, you asked, that's a good question. But really the medicine part is between Samantha and the client in that sense. But we do talk about dose so that, I say, well, what do you think about the dose? Oh, I think it was good. I'm ready for more. And then I'm like, okay, I think you might be. Let's talk with Samantha. So it's a three-way conversation always.
I usually prescribe a range. So there's like more freedom for the client to, oh, I changed my mind. I don't want to take, just one. I want to take 3 today. Yeah.
And where I do weigh in is people are saying, well, I'm getting, 1,000 milligrams from Mind Bloom today, and I'm going to take it all. I will weigh in on that because my job is the safety of my client. And there's a lot of scary stuff out there.
Yeah, I do want to talk about Mind Bloom protocol. They do good work, I think. It's a different model, but be sure that you don't swallow after you hold like 1,000 milligrams. Oh, because it would turn into, the metabolite can really hurt you.
I'm sorry, what is My Bloom?
Mind Bloom is a company that
Mail order drugs.
It's mail order, yeah. They do have like integration group virtually, but it's really hands off.
And now you can inject yourself.
Now you can inject yourself with, it's a subcutaneous. It goes into your fat. It's not going into your muscle, but it goes into your fat.
So again, I think what we try to present here is what we consider best practices in terms of the collaborative mixing up the medicine model. And there's so many ways to access the medicine. I have an idea, I think you have an idea of how to get the most out of it and be safe. And it depends what you want from it too. Not everyone wants to have a deep therapeutic experience. But, what I'm here for is that, and for people to really just get connected to themselves in a way that makes their life more satisfying, more meaningful if they want that, and just for their overall well-being. So that's what I'm supporting. And, there are many other ways to do this, but this is how we do it. And I'm very lucky to have you as a
Same. I love that. You were actually my first person in contact. Because when I first moved here 4.5 years ago, and 4 years maybe, I said, well, who is doing ketamine therapy here? Nobody. And you reach out to me, you're like, oh my God,
right.
Let's have a coffee. So
Meant to be.
Ever since.
Yeah. And the other part is Samantha and I have both encountered people who have had negative and traumatic experiences locally as well. And so I think I've learned a lot from how to help people with that. And I'm sad that some of my work is about repairing those experiences. So part of my commitment when I do these talks is to educate you guys, and maybe you guys can go out and educate other people about how to take care of yourself when you're doing this. And to know, I am so for the medicine if you're doing it in a way that's safe. And you can get it very quickly and easily, but that's not necessarily the way you want to get it. So that's my final.
Yeah, you don't know what you don't know. You can't really predict what will show up sometimes.
Which what you don't want to do is be in therapy for the next 10 years trying to fix a bad ketamine experience.
Right, or it's a bit fun.
I want to thank you all. You guys are awesome. Hope to see you around me.